Hi, good evening. My name is Sarah Mahmood, and I'm the student nurse practitioner, and I will be checking your HENT and your respiratory systems today, okay?
Okay.
So first I'm going to start by just looking at your head, and I'm just checking your scalp for any bumps or lumps, and I'm looking for any symmetry or anything like that. Next I'm going to do I'm going to do your temporal pulses. Okay, that's good. I'm going to just check your cranial nerves. First, can you lift your eyebrows for me? Squeeze your eyes shut tight. Okay, you can open them. Can you frown for me? Okay, puff out your cheeks. Yeah, and then smile with your teeth. Very good. I'm going to have you shrug your shoulders while I put pressure. Okay, great. Now I'm going to check your Meister and your temporal muscle. I want you to clench your teeth for me. Okay, now open and close your jaw, and I'm just feeling for any clicking or any discomfort, and you seem good with that. Now I'm gonna have you close your eyes and just tell me when you feel something on your face, okay? Just say now.
Oh. No. No. No.
Okay, great. Now I'm just going to look at your eyes, and I'm just looking at the external structure. Your eyebrows look good, your eyelids are good. And I'm looking at your conjunctiva, your sclera. I'm just going to, okay, there's no redness, everything looks good. Okay, now I'm going to test you for accommodation and convergence and EOMs. So what you're gonna do is you're just going to follow my finger, but without moving your head, okay? And I'm just looking for nystagmus, and I'm just seeing how you're tracking with your eyes. Everything looks good and perfect. Now I'm going to be shining a light in your eyes. First I'm going to be checking for your constriction for your pupils, and then I'm going to check again for constriction, but in the opposite eye. It's called concentric, okay? So I'm just going to you could just look over my shoulder. Okay, and your pupil constricted. Now I'm going to check the opposite eye. Okay, just try to keep your eyes straight, okay? Now I'm going to check the other eye. Okay, and again. Okay, great. So now I'm going to be shining the light more into your eye, and I'm just going to be checking for the structures in your eye, okay? So for this one, I'm using my right eye to look at your right eye. I see the red reflex. You could just look straight at the light, sorry. And I see the disc and cup, the macula and fovea. Okay, and I'm gonna do the same thing using my left eye with your left eye. Just look straight ahead as much. I know it's uncomfortable. I see the red reflex, the disc and cup, the macula and the fovea. Okay, great. All right, great. Sorry, I know that was a lot of light in your eyes. Oh, sorry. Okay. So now I'm going to be just checking your ears, okay? So I'm just checking for any bumps and lumps. Do you have any pain anywhere?
No.
Okay. I'm going to be doing the whisper test on you. So I'm going to be saying a few words, and then you just whispering them to you, and you repeat it back to me, okay? I'm just going to close this ear.
Blue. Red. Purple.
Okay.
Cat. Dog. Goldfish.
Okay, great. So now I'm going to be using my otoscope to look into your ear, and I'm just going to be checking for any wax buildup, and I'm just going to be seeing how your tympanic membrane is, okay? And I'm just going to pull this back, straightening out your ear canal. Okay, and your tympanic membrane is pearly and gray. Great. with minimal wax buildup. Again, I'm pulling the pinna up and back. Very good. Okay. Now I'm going to be, so that was me checking your external auditory canal. Now I'm going to just check your nose, okay? So for your nose, I'm just checking for any deviation, alignment. First, we're gonna check for patency. I'm gonna have you sniff when I close one nostril, okay? Sniff. Okay, great. Sniff again. Okay. I'm gonna shine a light in each nostril. Okay, I see the turbinates. I don't see any polyps. Yep. Okay, great. Okay. Next, I'm gonna be checking your mouth. So here, I'm just looking at your lips. Can you smell? Go like, yeah, very good. Your teeth. Sorry, I need the light again for this. Just give me 1 minute, sorry. So I'm going to be shining the light just to see what is going on in your mouth. All right, very good. You can open your mouth, very good. I see your uvula. I'm looking at your mucosa. Lift your tongue up for me. I don't see any lacerations. I'm looking at the soft and hard palate. Now, can you stick your tongue out for me all the way? That's checking a cranial nerve. And now I'm going to check your gag reflex. Stick your tongue all the way out. Say ah.
Ah.
Okay, great. Next, I'm going to be checking your throat and your neck. I'm just checking, looking at this, looking for any masses, symmetry. I see your trachea is midline and no deviation is happening. Next, I'm going to check your thyroid, your all of that stuff. So the pre and post auricle, and I'm just feeling for any pea-size masses. I'm doing your occipital and posterior and cervical, anterior cervical, superficial cervical, deep cervical chain, your supraclavicular ones, and I don't see anything there. And then I'm going to check right under your chin for the jugular and the submandibular and subclavicular. Okay, great. Now we're going to check for your thyroid to see if it's enlarged or anything. I'm going to have you take a sip of water. I'm going to have you move a little bit facing the camera, just a little bit, okay? So first I'm going to have you take a sip, but don't swallow the sip yet, okay? I'm going to have you lean forward, tilt your head forward, and tilt your head back. Very good. And I'm just using my left hand to push the thyroid towards my right hand and swallow. Okay, great. And now we're going to do the same thing doing the other way. Take another sip. Okay, I'm going to have you tilt your head forward and to the left. No, just tilt, yes. And now I'm going to use my right hand to push the thyroid towards the left. Go ahead and swallow. Okay, great. So that concludes our HEENT checkup. Now I'm going to be checking your lungs, okay? And for the purposes of this video, you're not going to be taking off your shirt.
Nope.
But what I would do is, first I would inspect your whole chest to see if there's any bumps or bruises or any scars. And I would do the same in the back. And then I'm going to check your AP. It's 2 to 1. And now I'm going to, that's percuss. So it's just gonna be I'm just going to be percussing for. And I'm going to do the same thing in your back. You could, yeah, you could face a little bit towards the camera. Okay, now I'm going to be listening to your lungs. So anytime you feel the stethoscope move, I just want you to breathe in and then exhale, okay? I'm gonna do the same thing on your back. Okay, thank you very much. And that concludes our exam for today.